all of you are going to find it much beneficial in your future pathway. Thank you very much. And with this, I would like to invite the team members of the HIVE Academy. Mr. Asma, kindly come and please continue your question.
One of you to join the session. I would like to say a very special thanks to Professor Shumaila, the Vice Principal of DOW Medical College. Thanks to my high team who arranged this session and gave me this opportunity to speak in front of you. Thank you so much. Now let's begin with the introduction of my company, HIVE Medical Academy. You people must be wondering, what is HIVE Medical? HIVE Medical Academy is established by a team of doctors and healthcare professionals. It takes Pakistani doctors for their career building, professional growth, both in Pakistan and abroad. HIVE Medical Academy has been preparing the doctors since 2013, and our passing rate is 94%. So basically, we are a team of doctors and healthcare professionals, and in order to build the career building, professional growth of doctors in Pakistan and abroad. If you are a doctor, dentist, nurse, or any other healthcare professional, if you want to work and settle in UK, HIVE Medical Academy is the only choice for you. Sir, you are audible. Go continue.
Thank you so much, Asma. HIVE Medical Academy. I will tell you a bit more about. I graduated from Pakistan, from Eastern Medical College, and then moved to UK. So I have been through this PLAB journey. I completed all the exams. I've been in NHS. I'm a consultant geriatrician, and I'm founder and CEO of HIVE Medical Academy. The aim of HIVE Medical Academy to facilitate doctors. I did training to support and our starting from the PLAB exam. We are the one-stop solution provider. We do everything from your English test. We help to pass your English test, either it's IELTS or OET, and also have the PLAB journey. So PLAB exam is very difficult, especially because of the cultural difference, because of lots of other things. If we compare, see the GMC data, doctors coming from the Pakistan, the numbers are really very less. There are only 5 to 7,000 doctors come every year from Pakistan. As compared to India, there are 20 to 30,000 doctors coming. When they did explore it, why is happening? The main reason there was no professional academy, sport, or guidance in Pakistan for the Pakistani doctors. And I could tell this one when I came, and many of my friends, we came to UK with the PLAB. We didn't have any professional sport guidance or anything. Similarly, today we are the pioneer in Pakistan, HIVE Medical Academy, providing one-stop solution for all the facilities, all the information, all the support throughout the PLAB journey. And we're proud to say we are the only academy in the UK who supports you even after passing the PLAB. We are the only academy. We provide guaranteed clinical attachment in the UK. And we are the people who have been through the journey. We know everything. And we have been in NHS in the system for more than 20 years. I have been involved in the recruitment. I have been educational supervisor, clinical supervisor. I have been mentor for the doctors, junior doctors, nurses, ANPs, pharmacists, and all of them. The rest of our examiners, PLAB examiners, PLAB tutors, there are either ex-PLAB examiners, they are consultants in NHS, and the GPs with the decades of experience. So our aim is to make sure you pass your exam in first attempt. We have the services for the doctors who don't want to come to abroad. They want to settle in Pakistan. They want to stay there for any reason. So what we do, we have CPS preparatory courses. We have got NRE exams preparations, and we have got all other exams which could help them settle in the UK, in Pakistan, in the UK, whenever they want to come. For IELTS and OET, we have got the top faculty working with us to help you pass your exam. We have got Ms. Noreen Mirza. She is the linguistic expert. She has got 35 years of experience, and she has been working with British consulate and American consulate. She is IELTS and OET examiner. So up to now, we have done almost 20 batches of IELTS and OET exam, and everyone passed in first attempt. So we want to say that we are here to guide and support and facilitate you throughout your career, starting from your step one when you decide to come to UK, when you decide to take your exam, from there till you get the job, and even after that, if you need us, we will be there for you. I have got Dr. Umar. He's a co-founder. He's a GP in NHS, and he's been in NHS for 20 years. So he's going to give you a bit more information about your PLAB journey and how we could support throughout your career in the UK.
Thank you, Dr. Shakeel. Good morning, everyone. Thank you to Professor Shmaila, Professor Zohra, Professor Momal, and all the faculty members at DOW Medical College. It's an honor for me to be here, and what a wonder of technology that I'm sat here at 5 o'clock in the morning in Manchester, and I'm speaking to you guys in Karachi in Pakistan. Isn't that amazing? Thank you, Asma. Thank you, Dr. Shakeel. I'm just going to very briefly tell you a bit about myself. So I was born and brought up in the UK. I'm a local graduate. I graduated from medical school in the UK. I've been in the NHS. The first part, as I mentioned, is a written exam. The second part is an objective structured clinical examination, or what is otherwise known as an OSCE. Hopefully you guys will be familiar with the term OSCE. Both of these exams will test your knowledge based on current best practice in the UK. The PLAB one, as I already mentioned, is a written exam. It's a multiple choice exam made up of 180 questions done in a 3-hour session. And this is sat in Pakistan, and there are two centers. So one exactly where you are in Karachi and the other one in Islamabad. Each essentially just starts with a short scenario, and there is of 5 answers usually, and the single best answer is the one that you should choose. How are you going to manage to understand what topics are covered, topics are required, what topics does the GMC want to test in these exams, how are you going to practice for all of these things? This is where HIVE Medical Academy comes in, with our bank of thousands of questions, mock exams, our live teaching sessions and recorded sessions to get you up to speed to be able to pass your exams in the first go. So for PLAB 2, it'll be very, very exciting. You guys, you'll be making a trip to the UK, and it's an OSCE examination held in my great city of Manchester. It's 18 scenarios, so you'll be familiar with OSCE examinations, hopefully, where you will remember that you are either seeing a patient or you are demonstrating some clinical procedure on a mannequin or on dummy. And there are 18 scenarios, each lasting 8 minutes. Total exam time is just over 3 hours. And you get about 1.5 minutes to actually read the scenario, which is available for you, and a little bit of thinking time before you can move into the station, where there will be either an actor who is playing the part of a patient and an examiner, or there will just be an examiner and a model. You will need to control what the station is requiring of you, and there will be a couple of rest stations in between. So PLAB passing rates can be quite variable, as you can see from the screen. So starting from 2016, coming all the way to 2020, the pass rates vary from around 74-75% to as low as 63%. Now, this is, of course, where HIVE Medical Academy comes in, and this is where we are here to fully support you. We will be there to give you full teaching sessions according to the GMC blueprint, which is exactly as the GMC require your competencies for you to show your competencies. And of course, we will be able to, inshallah, boost your pass rate up to that 100% that you want to pass it in the first go. Once again, to mention the pass rates for the latest data we have, which is 2021, for PLAB 1 was 74.7%, and PLAB 2 was 54.9%. And as you can see at the bottom, 4,500 doctors sat PLAB 1, only 3,405 passed, and 1,614 doctors attempted PLAB 2. So they came all the way to the UK, made that trip, got the visa, sat the exam, and unfortunately, only 886 of them passed. So this is what we are determined to hopefully not let happen to you guys who want to come to the UK, want to practice in the UK. What about the other things which surround the examination or the process that you have to go through? So, eligibility criteria. All you have to have is your MBBS degree. So you just need to be a medical graduate. You do not need to have done a house job. You do not need to have done any clinical practice or any actual clinical experience. All you need to do is to be a medical graduate. So hopefully all of you sat in the hall there today, whichever year you are, hopefully by the end of your medical degree, you will have that in your hand, and then you are eligible to register for PLAB 1. So PLAB 2, similar challenges. There are logistic challenges for how you are going to get the visa, how you're going to go out to the UK. You need to prepare. PLAB 2 is a clinical exam, so you need to be able to practice face sessions. You need to practice with the mannequins, the models, doing all the procedures that could come up within the test. And there's other support as well, as I've mentioned. You know, you are going to go to the UK. Where are you going to live? How are you going to stay? How are you going to get to the actual the examination center, or how are you going to attend the face-to-face sessions? So this, we will handle all of this for you, and there will be no stress for you in this whatsoever. So you may or may not have heard of the term UK MLA. So currently, of course, the GMC uses the PLAB 1 and PLAB 2 exams to license doctors coming from abroad who are international medical graduates. The GMC have told us that in 2024, at some point, the introducing the UK MLA, which is the medical licensing exam, medical licensing assessment. Now, this is not only for international medical graduates, it's also for UK graduates who have finished medical school. They will also need to sit the same exam to be able to practice in the UK. Essentially, to keep it simple for you guys, nothing will change in terms of your actual move abroad from Pakistan. And until these changes come into place, you can still apply through the PLAB process and continue to apply for a license to practice in the UK. When the changes do come into place, and there's no formal date announcement yet, there will just be a smooth transition, and we will of course be here again for you to help you through that. Essentially, it will be some minimal changes in competencies, but a change in the label of the examination. So just a little bit more about the UK MLA. So as I mentioned, we have PLAB 1, which is a written exam, single best answer, and the equivalent of that in the MLA, UK MLA, will be the AKT, which is the applied knowledge test. Same kind of thing, written exam, few sittings available each year. PLAB 2, which is the clinical exam, the OSCE, the equivalent in the UK MLA will be the CPSA, Clinical and Professional Skills Assessment. And just like your PLAB 2 exam, there will be scenarios that will reflect real life work, mock consultations, potentially even a mirroring an acute ward. And so nothing too significant will actually change for you guys apart from the label itself. So currently the GMC has what's called the GMC blueprint for PLAB. There are various areas that they require knowledge in, so clinical practice, professional capabilities, practical skills and procedures, and patient presentations, etc. The UKMLA content map is also very, very similar, and so the same basic competencies will be covered as they are currently for the PLAB. So you may be one of the candidates who entered the process while it is called PLAB, but during the transition, it becomes UKMLA. And so there may be a scenario where you have passed one part of the exam, for example, and the other part you have not yet passed, and the change gets made from PLAB to UKMLA. It's very straightforward. You don't need to worry. The process will remain the same. It's only the labels that will change. So if you enter the process, you haven't sat any parts of the PLAB exam. If you've passed both parts of the PLAB test, then the same rules will apply to you. You need to be fully registered with the GMC within 2 years. If you have passed PLAB 1 but not done PLAB 2, instead of taking PLAB 2, you'll take the UKMLA version, which is a CPSA. And if you've attempted PLAB 1 but not passed it, you'll be sitting the AKT on the next attempt, etc. And if you've passed PLAB 1 but not passed PLAB 2, you'll be taking the CPSA instead of PLAB 2. So, what is the ultimate goal of talking to you about these things? Getting a job in the NHS in the UK. So now we're going to move on to a little bit about the NHS, tell you about what a wonderful place it is to work, and a few things about the NHS. So the NHS is one of the biggest employers in the world. It has tens of thousands of employees. Of course, you guys as medical graduates, you will be doctors within the NHS in whichever specialty you choose. Many perks to working in the NHS. I worked in the NHS for many years. As you can see on the slide here, there's annual leave, paid annual leave. There's housing schemes. For those of you who are into cars, you get through the lease scheme, the NHS. Flexible working, depending on which specialty you choose. Lots of options available to you for job share, flexible working. EWTD, European Working Time Directive, it is something that was brought in quite a few years ago now to limit the number of hours that doctors have to work to keep them safe, and possibility for career breaks, NHS discounts, and the NHS pension, which is one of the best pensions that you can be involved in the UK, with a huge tax-free lump sum at the end and lots of perks along the way. So there are many pro points to working in the NHS, and that's how we will hopefully help you get there. So suppose you are interested in moving to the UK and you want to sit your PLAB exams. We've got a whole host of packages available for you. All of the exams that you require, all of the services, as you can see, big slide, but it's just to show you the types of packages that we offer. Lots of face-to-face teaching, lots of audio resources, video resources, flashcards, as well as live teaching, and lots of services post PLAB as well, which is what sets us apart from all the other academies that you might come across or you might hear the names of. We will continue to support you even after you have passed your PLAB exams, because of course you will need to get a job, you will need to get a clinical attachment, you will need to settle in the UK, you will need to find accommodation, you will need to get orientated to the NHS, which is a totally different system to what you will be used to. And all of these packages, you will they are totally customizable, and you will not be able to beat the prices that we offer. So you might have many questions in your mind regarding journey to the UK. When should you apply? How should you prepare? Do you need the academy or do it? This is the key question. The guys at HIVE Medical Academy, having seen the work that they do, having heard the feedback from the doctors who have passed through, and now myself, having done that, this is not a journey you should attempt alone. As Dr. Shakeel mentioned, when he made the trip to the UK, there was no professional support, there was no academy, there was no guidance, and they kind of had to make it up as they went along. You should most definitely an academy, myself, Dr. Shakeel, the rest of the faculty members. We have got experienced trainers, not only around working in the NHS, but also passing UK exams, and of course all the process related things that are relevant to moving to the UK. So you're going to get a visa, how to book your ticket, where will you live, how to get a job in the NHS, how do you ensure you're ready to work in the UK, in Pakistan only. The key message though here is when you join HIVE Medical Academy, you will be able to just focus on the exams, focus on your studies, and we will handle everything else. So just a quick recap of your journey to the UK. So step 1, get your medical degree, be eligible to sit the PLAB. PLAB 1, written exam. PLAB 2, practical OSCE examination. Step 3, PLAB 2. Step 4, be ready for the NHS. We'll get you a clinical attachment. We'll get you experience working within the NHS before even you apply for jobs. And then the final goal is, of course, working in the NHS. So all of this can be done in 10 to 12 months. So the English requirement, first of all, couple of months, PLAB 1, 3 to 4 months, PLAB 2, which of course, as we mentioned, will involve traveling to the UK. That can be done also within around 3 months, and then post, including the clinical attachment, sorting out your CV, helping you apply for jobs, getting you references. That will take a couple of months. So that's all from myself. Thank you very, very much for listening. I'm going to hand back over to us. Then there's an opportunity for question and answer that we should play for you guys. Yes, no problem. Dr. Shakeel, do you want to take this question?
Yes, sure. Yeah. So, as I said before, we're here to support and guide everyone. So we have got very flexible, very affordable packages. Our aim is just to help you to pass your exam. So we are open to discussion. We are here to help you. So it's just the minimum cost. Nobody else could offer you the courses which we do it. So just contact us and we'll have a detailed discussion to help you to pass your exam. As compared with India or any other country, their passing rate is much higher because they start guidance from day one. When they start the plan for the PLAB from final year medical school, they pass their OITs or OET and then pass their PLAB 1, and the day they get the results for final year, they move here, they start our foundation program. So anybody, I would strongly recommend anybody who wants to work and settle in the UK, want to have the better career in the UK, they should plan from the final year. You start preparing for your final English test, and then you register for your PLAB. So once you have got your degree, straight away you could move to UK and you could start your foundation program. That will save your time. And you'll be consultant within 5 to 7 years straight away in NHS. So training, all sort of jobs are available. As I mentioned before, just it's completely your choice what you want to do. You want to go into training, or you don't want to go into training. So you have all sort of opportunities available.
So I think the question was, what's the difference between a training and a non-training job? But it's okay, I'll take it, Dr. Shakeel.
Oh, okay.
It's okay. The audio is not quite clear. So
Mhm.
a training job is where you enter a training scheme in a particular specialty, whether it's a medical or surgical specialty or any other specialty, with career progression. And the end goal is for you to be a consultant, which is the highest possible grade in that particular specialty. A non-training job is where you are fulfilling a particular requirement, whether it be on a ward or whether it be in another unit in a hospital, but there is no career progression within that actual job. So you are there as a middle grade usually. So you may be there as an SHO, senior SHO, or a staff grade, and you are there just fulfilling the requirements of the hospital or the unit or the ward for them particular patients without actually moving through a supported training scheme. So that's the difference between a training job and a non-training job. I hope that answers the question. So Asma, do you want to repeat the question, please? Because it's not very clear.
Yes, Dr. Aman, she's asking basically that there are many rumors about the jobs in UK, even after passing the PLAB exam. So what will you say about it? Even
You
after
mean difficulty getting the job?
exam, rumors that they are not getting.
Okay, no problem. The NHS actually currently is struggling in terms of meeting the demand of the patients, and there are lots and lots of jobs. And myself and Dr. Shakeel come across this every day. There's lots of locum agencies. There's lots of other organizations trying to get doctors to fill posts. So using two issues. One is uh, the difficulty after getting PLAB. You haven't got any experience, or your CV is not up to the required standard, or you don't know how to actually apply for the jobs or how to present yourself in an interview, versus actually getting a job. Having being able to do all of that, and there is plenty of work available. So this is where HIVE Medical Academy comes in. We can help you make that step from passing your exams to actually securing the job. Now, there are various steps, as we've discussed during the presentation. So you would need to have an outstanding CV. You would need to know how to interview well. You would need to be familiar with NHS procedures and protocols. And there will be other things that you will need to be aware of. You will need to have done a clinical attachment to show that you are able to function in an NHS workplace. So it's certainly not true that there is a shortage of jobs. There is a whole host of posts that are unfilled in the NHS, and we read about this and hear about this every single day. But there is a difficulty for international medical graduates to make the transition. But that's where HIVE Medical Academy comes in. Dr. Shakeel, do you want to add anything to that?
That's fine. Completely agree. Clinical attachment, your CV, professional CV up to standard. These are the things which will boost up and make sure that you get the job. And that's why we are here to help you and guide you step by step to make sure you get the job once you have passed your PLAB.
Thank you, guys. Any other questions? Just get in touch with Asma or anyone else here at the team. Thank you. Thank you for listening.
Thank you so much. Thank you.
Thank you so much, everyone. Thank you.